The following is a presentation of Spark Study Club. To see our course library and claim your free lifetime membership, visit sparkstudyclub.com today. Enjoy the podcast.
Hi, everyone. I'm Adrienne Good with Spark Study Club, and today we are joined by Dr. Mark Donaldson, who has an upcoming CE webinar titled From Panic to Protocol, Mastering Medical Emergencies in the Dental Office on Wednesday, April 22nd at 5 p.m. Pacific, 8 p.m. Eastern. You can register for that at sparkstudyclub.com. So let's start by getting to know Dr. Donaldson a little bit better. Dr. Donaldson is currently Associate Principal of Clinical Pharmacy at Viziance Advisory Solutions and lives in Whitefish, Montana. He's a clinical professor at the University of Montana, clinical associate professor at Oregon Health and Sciences University, and affiliate faculty in dentistry at UBC. He also serves on the editorial board for the Journal of American Dental Association and is the 2026 recipient of the Academy of General Dentistry's Dr. Thaddeus Weeklew Award. Thank you so much for joining us, Dr. Donaldson. That was a very nice intro, by the
Oh,
way.
absolutely. You did a great job. Thank you.
Yeah, thank you so much for joining us. This topic is interesting for sure. Panic to protocol. That alone is just something you don't want to have to deal with, the word panic in any kind of clinical setting. So I'd love to just get started with some questions regarding this exciting webinar.
Sure, you bet. Let's jump into it.
All right. So how did you become interested in dental pharmacology?
Sure. I mean, this actually goes way back. My father was an oral surgeon and is actually accredited with bringing the use of IV diazepam, so that's IV Valium, to the dental realm in Canada. So that's actually going back to the early 70s. So he graduated from the Edinburgh College of Surgeons and was doing sort of a trip through Canada and was invited to join the faculty at the University of British Columbia. And from those kind of early beginnings, I grew up in a dental household. He never encouraged me to go into dentistry, but he did say that, dentists as well as his medical colleagues really don't know a lot about pharmacology. And so, why not learn the pharmacy piece first? And if I wanted to continue my education in medicine or dentistry, that would be a strong foundation. So that's kind of where it all started. Emergency medicine, when I did my residency at Vancouver General Hospital, I spent quite a bit of time in the intensive care unit as well as the emergency and other critical care areas. And so, being around medications, having worked at 6 different healthcare systems in both the United States and Canada now over the last 30 plus years. So, it's definitely something near and dear to my heart.
So is there a specific event that took place that shaped your career? Is there anything in particular that stands out?
Yeah, I mean, I guess there's a point in your career where you realize that you actually enjoy it more than you were expecting to. I will tell you, in college, I was not the kid at the front of the class. I was usually closer to the back row, and I never expected to be the person in the front of the class teaching. When I got out and started to practice, I realized that pharmacy is actually very interesting. It's just typically taught poorly. And so, with that, I took a sort of personal mission to learn public speaking and to get out and actually start to teach a little bit more, either in the university settings or with study clubs, to get people to understand the clinical usefulness of pharmacology and actually to kind of enjoy it more than just. I think all of us had that rote learning where all we did was memorize drugs, side effects, interactions, regurgitated it on a test, hope to pass, and then never see it again. And so the courses that I typically put on are really much more clinically useful pharmacology, and I think that has much more benefit and let's just say staying power in regards to overall memorization and usefulness. So maybe not one inciting event, but certainly a few things that have kind of launched me to where I am today and what I've been doing for the last, as I said, 20 plus years.
Okay, and are there any misconceptions about medical emergencies in the dental office? Like, what's the biggest misconception about a medical emergency in a dental office?
Well, the biggest misconception is that it's never going to happen to you. And there's this famous quote by Nelson Mandela, which basically says, you can't be ever be properly prepared for something when you're secretly assuming it's never going to happen. So medical emergencies, when you do look at the statistics within the dental office, for every 2 years you practice, you're going to see a medical emergency. And so it is going to happen. It's really just a matter of when. I mean, we do our best to pick the right drug, right dose, right patient, right procedure. We have great staff preparation, all of that. But it's always possible to unfortunately find that wrong patient, wrong day, for whatever reason, and a medical emergency occurs. It also comes a little bit down to definition. So I think when people think about a medical emergency, they think of the big one, right? The heart attack patient or the stroke or the epileptic seizure, something like that. In fact, something as simple as a faint, syncope is a medical emergency. Most people don't realize that when a patient faints, their blood pressure actually drops to 0/0. Not for very long. We're talking a microsecond, but it is in fact a medical emergency. We've just become so, let's say, desensitized to patients fainting in the office that when they kind of come to and they're willing to continue dentistry, we just go ahead and finish the procedure. But many studies have shown that these patients actually do not recover hemodynamically for up to 48 hours. So I think that's the biggest take home is that medical emergencies are going to occur at some point. You can't predict them. We can do our best to be prepared, and that's really what what this conversation is about. Let's not panic. Let's be prepared. And so it'll be an important 45 to 60 minutes that everybody spends with us.
I mean, that is a good question. Like, what do you classify a medical emergency, which I'm sure you're going to cover in the webinar.
Absolutely.
So yeah, because you're right. It might not be something huge, but it's still classified as a medical emergency. So awesome that you're going to cover that. What is the most important lesson that you've learned about medical emergencies?
Well, I guess number one is call 911, right? Get the experts there as quickly as you can. These are the individuals, the EMTs, the ambulance folks that deal with medical emergencies every day, all day. We don't. And even the statistic that I mentioned, coming across a medical emergency once every 2 years you practice means that we're probably not very good at managing them. And I think that level of hesitation, should I call 911? I've got an emergency kit. We've done mock drills. I think that we can manage it ourselves. There's no penalty to you, right? Your insurance rates don't go up. The only thing that's going to happen is the patient could end up doing better than if you tried to manage it alone. So you are never wrong by calling 911. I think the other piece then that goes along with that is, you have to know your PABCDs. So that's your position, airway, breathing, circulation, D, definitive care, which could be the use of drugs or an automatic external defibrillator. But it so easily rolls off my tongue. But if you're in the trenches doing dentistry day in, day out, and you're not practicing routinely emergency preparedness with your team, that's not the time that you want to fumble. And so I think you should try to be prepared. You should have those mock drills. Your team should know their roles. But at the end of the day, the most important thing is listen, just get help and get it as quickly as you can. And there's never anything wrong with calling 911.
Yeah, I was just going to say having the team have knowledge of all of these things as well is probably equally as important as the practice owner and doctor. Um,
Absolutely, yeah. In fact, that's a great point that you bring up because I think when a medical emergency happens, everybody sort of stands back and lets the doctor take over. Well,
mhm.
the doctor can't take care of the patient, get the medical emergency kit, and call 911. So everybody needs to know their role and kind of jump into that right away. You can't just rely on one individual to sort of save the day.
Absolutely. And so, where do you see additional intersections between clinical pharmacology and dental practice? Where do you see that
Yeah,
going?
that's a great question because I think that dental pharmacology is pretty simple, right? There's a pretty limited armamentarium of drugs. Dentists need to know a handful of local anesthetics, analgesics, antibiotics, maybe a glucocorticoid, some topicals, but really in everything I've said so far, that's probably less than 20 drugs. The challenge that we have, especially, today, is that all of our patients are on many more medications that we don't have a great expertise in. Those could be some of the new GLP-1s as an example. They could be heart medications. They could be cholesterol lowering medications, diabetes medications. And so knowing where to go to get good information quickly, especially if you're thinking that there's a potential drug interaction that you want to avoid, I think that's one of the pieces that really starts to emphasize this intersection between dentistry and pharmacology. So again, dental pharmacology in and of itself, in a bubble, pretty simple, pretty limited armamentarium, but having a phone a friend or a book on the shelf or an app on your phone that helps you understand how the very safe drugs we use in dentistry could interact with the over-the-counter medications, prescription medications, herbals, botanicals, nutraceuticals, illicit drugs. It's all about patient safety, and we need to know where to go to get good information quickly.
Absolutely. So, as far as the webinar goes on April 22nd, is there anything that we didn't touch on in this quick overview that you would like to let attendees know that they can expect?
Well, I think the key phrase here is chain of survival, and medical emergencies will occur. You want to be as prepared as you can. I think the Boy Scouts had it right. And everybody needs to know their role. So practicing mock drills, having an emergency kit, only those drugs that you need to have. So there's basically 8 drugs that make up the minimal dental emergency kit, which we'll cover. And having the ability to again jump into those PABCs after you've already called 911 means that take care of the patient first, and hopefully as long as you can focus on that position, airway, breathing, circulation, and definitive care. Within a few minutes since you've called 911, the experts arrive, and nothing untoward really happens to the patient. But preparation is definitely key here.
Absolutely. Okay. Well, I'm looking forward to the webinar. I just wanted to thank you so much for joining us, and I know we're all looking forward to it. This is a CE webinar, so you will be able to receive credit as well, but regardless, it's amazing advice, I'm sure. So again, the name of the webinar is From Panic to Protocol, Mastering Medical Emergencies in the Dental Office. It is on Wednesday, April 22nd at 5 p.m. and 5 p.m. Pacific, 8 p.m. Eastern. Don't forget to register, and I'm sure we will have a recorded version if you miss out. And that's it for today. Thank you so much for joining me.
Awesome. Thanks again.
Thank you. Take care.
We hope you enjoyed this podcast. To learn more about the topics discussed, please visit sparkstudyclub.com today and claim your free lifetime membership. Thanks again for listening, and we hope to see you again soon.